wants to live with chronic pain, but sadly many of you watching the show today even may be dealing with that very thing, wondering how you'll ever get to feeling better. Dr. Nick Circolone is here with Apple Physical Medicine and Rehabilitation, and he may have just the very thing that you have been looking for. And the best news of all, for most people, it's approved by your insurance company.
It is. And you know, there are some insurance companies that don't. You know, we still have to have patients pre-certified or pre-authorized to get them. But most of the time, yes, it is covered by insurance.
This is not anything new. We've talked about it a little bit on 3+U, and the procedure itself is not anything new globally. It's a little bit new in the U.S. It's called Stivax.
Yes, it is. And what it is basically a small neuropain stimulator, or a PENS unit, percutaneous electric stimulation unit, where we implant a little array in the ear for 2 weeks. We usually use some steri strips to hold it in there, Dermabond, anything to keep it in there sturdy for 2 weeks. And we have a small generator that it's connected to, and this generator creates a pulse. And what happens is this pulse then excites the peripheral part of the vagus nerve, or the auricular area of the vagus nerve. And what it does is it decreases pain by stimulating that nerve.
Okay, so where the insurance kicks in, the way it's been approved, is that you put this on for about 2 or 3 weeks?
2 weeks. 2 weeks.
Then you take it off, right?
Yes. And then we put a second one on for 2 weeks, take it off. Then we put a third one on for 2 weeks, and then we take it off. And then the pain level comes to a certain level and stays there.
Okay.
What's beautiful about this is that as we stimulate that auricular part of the vagus nerve, what it does is it keeps that endorphin level high enough so that way the pain control stays there.
Okay.
Now sometimes it'll drop off, and then we could do this again in 6 months. These are trials. For a lot of times what we do is there's different stimulators, and you have to have a trial for it. And what we're using these are for trials. And
Can I
some
hold
patients, absolutely. Some patients do so well with them, they never have to go to that next level.
I've heard you talk about this for a long time, and to be honest, the way I envisioned it is not the way it looks. It's a lot smaller than I thought it was going to be.
It is. It's almost to the point where you can hardly notice that you have it on.
So where does this part go? Obviously this is going to go in your ear, and it wraps around, I guess, your ear, but where does this go?
The small pulse generator has a little cradle where it fits right in the shoulder area, so it's hardly even seen.
Oh, that's great. So, and then you could just tuck it behind your hair or something if you have long hair.
Exactly.
Do you sleep in it? Do you shower in it?
You can sleep in it, you can shower in it. What's the beauty part about this unit versus other units that are trying to be like them is, number one, it is water resistant, not waterproof. You can't go swimming with it. It is adjustable.
Okay.
And it's the way we put it in, the way it's implanted, stays in a little bit longer and is more secure.
Okay, wait a minute. So it's water resistant but not waterproof.
Exactly.
However, suppose you had a trip to the beach planned. Can you take it off while you're in the water?
No, it's implanted in there, so you don't want to take this off because it doesn't do its job then.
Okay, let's talk about the types of pain it helps with. People might not understand chronic pain unless you ever dealt with it. You're seeing help for people with fibromyalgia?
Exactly. Chronic joint pain, knee pain, neck pain,
Does that
low
mean like
back pain.
rheumatoid arthritis?
Yes, it actually has worked for patients that have had rheumatoid arthritis. It depends on the patient, the pain level. We give them a series of questions, and we do a questionnaire and find out where their pain level is, so we can actually track how much better they are and how much improvement they're getting. One of the things is that here's the kicker. 50% of my patients get, I'm sorry, 50%, 85% of my patients get 50% or better relief from pain from this unit.
Okay, and you've explained that to me before. So if you're watching and for the first time thinking, yeah, but you still have pain left, true, but not nearly as much. So if you have been unable to get out of bed, let's say, because you're just so tired all the time and you hurt, well, now if you can get up enough to live your life, that's a big improvement.
Exactly. I've had patients come in after we've put the unit in for one day and come back and go, Doctor, I don't really see that much relief from this. I don't think it's really working. And then I ask them a series of questions, and they turn around and go, oh, I was really more active yesterday. I was able to be in the yard for longer than I normally have been.
Right.
So it's the perception to some people is like, really, it's not doing anything, but their activity level has increased, and they don't even realize how much they've become more active.
Okay, it also works in the reverse, where sometimes something is impacting you in such a negative way that you're coping and don't see what you're missing out on.
Absolutely.
So if a family member is hearing this today and they want to encourage someone to come and talk to you, they can at least come and talk to you,
Oh,
right?
absolutely. There's no charge to come to see me. What is really funny about that is most of the time, patients see the relief and, I'm doing much better. But there are times when patients will come in and they'll go, no, this is not working, it's not helped me at all. And then the spouse or a caregiver will turn around and go, oh, no, they're doing much better. They are doing much better.
Okay, I know each person's their own individual person. Can it happen where you'll put it on and for the first 2 weeks, maybe you don't notice anything different, but by the second 2 weeks, it begins to take effect?
Oh yes, we've seen it, and I've actually seen it where we've put the third unit on and they really have gotten no relief. So now we need to look at a different modality to go to the next step and see if we can get them out of some of that pain.
Okay, is it a simple matter of calling, and should people let you know right offhand who their insurance carrier is, and then you can at least tell them on the phone, yes, that one accepts it, or no, they don't?
What happens is you'll call into the office, you'll give us your kind of symptoms, and then the girls will ask you a series of questions, and sometimes they'll say, Dr. Sherklin, would you please call this patient? We'll call the patient, and I'll talk to them directly, and sometimes I'll find out that they're not a candidate for it. If they have a pacemaker, they're not a candidate for it.
Okay.
Okay, so that's one thing. If you're pregnant, you're not a candidate for it.
Okay.
You know, there's a couple little contraindications that we will not use the unit on.
And there's nothing wrong with doing your own research, so we'll spell it out for you. It's called Stivax, which is S-T-I-V-A-X.
V-A-X, yes.
S-T-I-V-A-X. You can Google it yourself, but if you want to go ahead and call the office, they're closed now on Fridays.
Yes.
He takes the day off, but Monday they'll be back open on Shallowford Road. They also have a new satellite location in Sale Creek. They're there a little bit every week, but the phone number on Shallowford Road is 855-7376. Online, applerehabgroup.com. Good to see you.
So good seeing you, Julia. Thank you.